experienced from the continent. So, in 2010, at a UN Security Council meeting, the president of the World Bank was the first to recognize a health problem as a threat to international security. He stated, "We face a major developmental crisis, and more than that, a security crisis. For without economic and social hope, we will not have peace, and AIDS surely undermines both. We need to break that vicious circle of AIDS, poverty, conflict, AIDS. For the truth is that not only does AIDS threaten stability, but when peace breaks down, it fuels AIDS. Of the countries in Africa with the highest prevalence of AIDS, half are engaged in conflict of one kind or another." And so in my paper, I try to take this approach of the relationship between AIDS and conflict as complementary, as a circle. So I gathered research from previous studies and published journal articles on the topic, as well as collected data from the World Bank Data Bank, which has compiled statistics from several different major organizations, including UNAID. I selected 4 states as case studies: the Central African Republic, Mali, Sierra Leone, and Rwanda, and analyzed how the nature of the conflict and the environment of the state impacted the spread of AIDS in those states. I did encounter a lot of barriers while I was researching. AIDS data is not available before 1990, when data began to be collected after the discovery of the disease. And data is also often scarce due to difficulties in accessing states and conducting research, especially in states where there is violent conflict. In addition, oftentimes, assumptions made by journal articles and by myself cannot be currently backed up by concrete data because it simply does not exist yet. So just some brief statistics. Of the 35 million people infected with HIV globally, 71% live in sub-Saharan Africa, and that's written in a recent UNAIDS report. And of the estimated 1.8 million people living with HIV affected by conflict, displacement, or disaster in 2006, 1.5 million were living in sub-Saharan Africa. Throughout the 1990s and even just the past 20 years in general, sub-Saharan Africa has seen many different violent conflicts. And so just going back to this as a vicious circle from HIV to poverty, conflict, HIV, AIDS. As I said, by the